November is Home Care and Hospice Month, and with a growing number of adults choosing to age in place, it's good to know what healthcare options are out there. So joining me right now is Kathy and Kelly Howard from Griswold Home Care in New Haven. Thank you both so much for being with us.
Thank you for having us. We appreciate it.
It's really important for us to know what types of care are available out there. So Kathy, why don't I start with you?
Okay. So generally, home care falls into three buckets. The first would be hospice care, the second would be home health, and the third would be non-medical. Hospice care is generally end-of-life care.
Right.
Specialized care facilitated by a team of doctors, nurses, social workers, and home health aides to provide comfort care. Mm-hmm. Generally speaking, the life expectancy of that individual is 6 months or less, and most treatment options have been either terminated or abandoned.
Kelly, a lot of people are just maybe starting to think about this. What do we need to keep in mind? Because it's very overwhelming.
It is
for a lot of people, right?
And it can be an intrusive part of your life. You're having people come into your home, take care of you, personal care, homemaking, companionship-wise. You're giving up part of your independence, allowing someone to come in and assist you with that. And it is also a very emotional part of your life too, especially for the family, when you see a parent declining in that way. With the home hospice and home health, there is the non-medical component as well, which we provide at Griswold, which assists with personal care, homemaking, and companionship for that client through their final months.
And it's that companionship that can really make such a difference emotionally and physically, because unfortunately, if your loved one is far away and you're not able to spend as much time with them, you want them to have some sort of companionship, someone to hang out with and laugh with, right?
Definitely. And through that process of getting to know that family and that client, we ask those specific questions. What is it that mom and dad enjoy? What can we do to bring to the care plan to facilitate joy in those final moments, whether it's assisting with a show or taking them out one day to somewhere that they love or bringing in their favorite burger.
Now, when we're talking about all of these options, insurance and cost really does play a part.
Definitely. There are many ways to pay for home care. Hospice is generally provided through Medicare, as well as home health for a general period of time. And as far as the non-medical goes, it is private pay, but there's assistance through Veterans Aid, there's assistance through long-term care, as well as other avenues through Medicaid and state contracts.
Oh, Kathy, talk a little bit more about how you sort of help people feel a little bit more comfortable, because it's a big change and some people maybe aren't ready for someone to come into their home. What should people be keeping in mind?
So when it comes time for the need for home care, generally you see the daughter, the son, make the decision for their parent that it's time. Do it for us. Do it just for a short term. There is a hesitancy involved, especially when it's the first time that your loved one needs care. And so being that person who can come into the home, who can connect with that individual on a deeper level, just other than performing a function, is probably the most important thing involved in developing a care plan. Understanding the patient or the client's life history, for example, taking the time to understand where they've been and what their life has been like, in order so that we can provide a caregiver who can relate to that. That is important.
Well, Kelly and Kathy, thanks so much for coming in here from Griswold. It really is important to start thinking about these things, these issues, these concerns early on.
It is.
All right. Thanks again for being with us.
Thank you.